Hi, Assalamu alaikum and good morning everyone. Thank you for visiting my channel again. Abdurrahim here with you. I hope you liked the previous videos and I'm hoping that you already know the anatomy and the circulation of the heart. Now we will come on to the machines that, for example, you are going to start your imaging from today. Okay, so I'll tell you what are the important things you need to look for. The first and very important thing once you come into do the imaging is to select a probe. Okay, like which probe you are going to ask. By the way, before this, once you come into the echo room, definitely you need to follow your organization or your institution's policies, like for example patient's data, for example how you are going to call the patient, what things you need to check for your patient, how you are going to scan a patient, how you are going to position a patient for the scan. So these all things you need to be following it once you are working with your seniors, so you will learn all these policies. So you need to follow those policies. Okay, they are very important and they are very helpful for you. Now your senior asks you to, okay, you can start scanning or you can learn the scanning in the meanwhile I'm doing the report. Okay, so the first thing is, like, we feel shy to ask, like, these are very small things. Should I ask her or should I ask him or her or not? So I'll give you the example. Like for example, you came in this room and I asked you to, okay, you can try scanning. So there are 3 probes attached to this machine. For example, this is one probe, okay, this is the second one, and this is the third one. So there are 3 probes attached here. So if I ask you, okay, you can try scanning, first thing is you should know which probe you are going to use for the scanning. Okay, because there are 3 different probes attached. If you look at the probes, every probe has something written here. Okay, by the way, let me tell you something about the machine. This is a Philips machine, Epic machine. Okay, so these are the probes with the Philips, but basics will be same. If you are using even the other machine, for example GE, Toshiba or any other machines, the basics will remain always same. Okay, so every probe has something written here, even in the other companies. If you don't find anything written here, then you can check the probes where the probe is attached. You can check it there and you will find it there, something written there. Anyway, this one is written X5, the other one is S9, and this small probe is with S12. So now how you will know that which probe I need to use for my patient? So these, whatever is written here, this gives us an impression about the frequency of the probe. So frequency has a lot of things to do with this. So I need to give you a simple understanding about it, that as much as the frequency goes up, your penetration goes down. Okay, so if you are targeting for a higher penetration in a patient, you will use a lower frequency probe. And if you are targeting a lower penetration in a patient, you are going to use a higher frequency probe. So they are opposite to each other. Okay, frequency and penetration. As much as your frequency goes up, your penetration goes down. So you need to keep in mind. So let's take the physics out from it and we'll come into the clinical. You are here in the echo room, the patient is here, now you need to scan. So for the pediatric patient, you are going to use a higher frequency probe. For adult patients, you are going to use a lower frequency probe, and for infants, even you are going to use a very high frequency probe, even higher than the pediatric ones. Okay, so for the adults, you are going to use roughly about 2 to 3 to 5 frequency probes. Okay, there are different probes coming in, you will see into the different machines, but the frequency should be around that. Okay, it will be written there or written here, you can find it there. Then the pediatric probe goes 8 to 10 frequency. Okay, and even that, if your patient is an infant, then you are going to use S12 probe. Okay, so this is as much as the frequency goes up, your penetration goes down. So the same thing, if your patient is an adult, you are going to use that probe. So this is a very simple thing. So once you come in, you see your patient is an adult, you are going to use the adult probe. If your patient is a pediatric, you will use the pediatric probe. And if it's an infant, you are going to use the infant probe. And how you will recognize the probe from the frequencies which are written up here. Okay, this is one thing. Now the next thing is that this is a technical thing. That sometimes maybe you are doing a pediatric patient. Okay, you are doing an adult congenital patient and your patient is a pediatric patient with an age of maybe 13, 14 or 12, but he is quite a healthy guy, he's an obese patient. So if you are trying to get the images with S9, you might not get the best of images. So at that patient, you might need to go towards your adult probe to get the better images because your penetration has increased, okay? So to increase penetration, you will use a lower frequency probe, okay? In the same, if you are having an adult patient and he is very obese and you are using the probe, like for example, an adult probe, and you are not getting the best images, try to decrease the frequency. There are options on the machine to decrease the frequency. I'll show you later on. I'll tell you about the knobology of this machine and also the GE ones I'll be working, and I'll show you how you can decrease the frequency of the probe. So you can decrease the frequency to just increase your imaging, to increase your depth and to get better images, okay? So this is done. So if now you know, like once you come into the room, how you are going to select the probe and how you are going to do it, okay? How you are going to start your imaging. So I'll see you in the next vlog with the machine knobology. I'll tell you about this Philips machine, and then once I'll be working on GE, I'll tell you about the GE machine. Okay, please subscribing and sharing with the others. Thank you. Bye-bye.